20 years ago, there was a group of medical students with a dream. They dreamt of stretching out a helping hand to those in desperate need of care, but lacking the means to pay for it.
The group which is involved in actually building the hospital, running it, and was behind the planning of it, these are all doctors which we all work together in various few years here and there, take a part in Dow Medical College. And while we were studying, and an organization there exists, still exists, works very hard, is called the Patients Welfare Association. So many of us have been involved with Patients Welfare Association, and the purpose of the association was to actually collect funds for the poor and needy patients in the hospital. Then we realized there, while we were there, that the facility there in civil hospital was inadequate and it needed upgrading, and we got about it, many of us, in various ways. First we got the emergency accident department built, then the cardiac surgery, the gynae, the various things. But it was very, very clear that this is not enough.
The students became doctors, some of whom went abroad to pursue specializations in various fields. But the dream was only half realized. What the doctors had in mind was a hospital that would offer the best of care, free of cost.
We had the mission of making a hospital, so I thought it should be earlier the better, because life is too short. So we sat together and started planning this hospital.
The Islamic Mission Trust had a similar goal, but its plan could not go beyond the construction of a hospital building in the Korangi area in the 1990s. It was only when the doctors group learnt of this facility that the dream began to take shape. The Rufaida Foundation entered into an agreement with the Islamic Mission Trust, and the work went forward. Finally, 20 years after the mission had first been vocalized, the Indus hospital became a reality.
But the whole idea of building Indus hospital is to try and help out the common man, where in terms of healthcare being so expensive now, if you can provide them with good quality care, if the ones that I would want for myself, it doesn't have to be that if they can't pay that they should also get bad quality.
With the help of a team of dedicated volunteers, the building was revamped, staff hired, and systems set into place. Today, the hospital provides a range of comprehensive services to those in urgent need of medical care.
The hospital has been directed more towards the procedure oriented. When I say that, if a patient requires a test being done or medicine being given, he somehow does with difficulty manage to do that. But if you tell him go get this procedure done or this operation done, then his back is broken. On the surgical side, we have a general surgery, a very strong orthopedic and trauma setup, because we get a lot of such patients. Urology, cardiac surgery, we do bypasses and we do all of those surgeries as well, and ENT. It has 6 beds intensive care ventilated beds, 6 coronary care ventilated beds. It has an emergency department. It has the latest lab facility where all tests are being done here.
It is a state-of-the-art facility that ensures quality healthcare entirely free of cost.
I'm trying to take out as much time as I could and give it over here for this great cause, जिसमें हम सब मिलकर जो है वो लगे हुए हैं. What we look for जब हम यहाँ वापस आते हैं, that we want to give some time, some energy, some money, whatever. We want to give it in something real, pure and a straightforward type of thing. This was the good thing about this hospital, that we are fully satisfied that whatever we are doing, we are getting 100% out of that.
Anyone who walks in is offered the best of the hospital's facilities with no questions asked. Advanced technology keeps Indus Hospital at the cutting edge, and human dignity is respected at all costs.
हम चल नहीं पाते थे, माशाल्लाह हमारा कामयाब ऑपरेशन हुआ, बहुत अच्छा हुआ, बिल्कुल मुतमईन है, बहुत अच्छा अस्पताल है, माशाल्लाह हर किसी को ख्याल रखते हैं, हर गरीब अमीर कोई नहीं देखते हैं, बहुत अच्छा ख्याल रखते हैं हम. हाँ बिल्कुल ऐसा लग रहा हम तो घर पर हैं हम.
This is the first hospital in the country with a fully computerized medical information system.
We are basically the pioneers of the paperless hospital. Not only the paper document, in fact, we have computerized. We have also developed our application for the ultrasound for the radiological imaging as well, like ultrasound, X-rays, fluoroscopy, and other things. We also have a non-invasive cardiology departments here, so we also develop procedures for computerization of those aspects as well. We have a system, whenever anybody is hired in the hospital, basically, they have to come to MIS for 8 days at least. They go for a proper training system. Then finally they go for examination. They just appear, whatever the level you have, either you're a senior doctor or a nurse or a technician or whatever, you have to go for a examination system, proper examination system. And then if we actually pass them up, then they're going to go for our system.
There are no misplaced files and no waste of time at Indus Hospital. In addition, the system builds up a wealth of information to feed into research and health policy.
If you go to any international meeting, you will see a global map with various disease patterns from this country, that country, and usually Pakistan is white because there is no data available from here at all, which is a sad state. We're trying to change that altogether.
IRD stands for Interactive Research and Development, and essentially what IRD does, it's a not-for-profit organization which does public health research primarily, and also has a service delivery angle to it. When Indus was conceived, it was also IHRC also was sort of started up. And it's essentially a collaboration between IRD's research component and Indus Hospital's service delivery component. And essentially when IHRC was formed, one of the projects we started in the community was this pneumonia surveillance project. So the requirements of the pneumonia project were essentially that we needed to track children from the age of 6 weeks till 2 years. What we did was we gave them RFID tags, which is radio frequency identification tags, were put in on children's hands, young children, 6 weeks old, and then they've been tracked for 2 months. You get these mobile phones which have near field communication and can read those tags. And those phones were placed in different locations, including Indus Hospital and other GP clinics and other immunization centers. And every time a cohort child, which is a child who is being followed, comes to one of those centers, their tag was scanned and we knew they had arrived over there. Let's say a child has pneumonia and they've come to our GP clinic and they have severe pneumonia. GP sends out an alert. Our mobile team goes to the GP clinic, picks up the child, brings them here for a blood culture and an X-ray, and then if they need to be hospitalized, they would be hospitalized.
Community outreach ensures patient compliance.
The one other thing we do is specifically for, let's say, our TB program, because it has that DOT component of directly observed therapy. Every time a new patient is enrolled, we go back to their home and we map their house and we take GPS coordinates. Once we take GPS coordinates, it shows up on our Google application. And what that directly ties into is this open medical record system we've been working on, which shows their previous history, have they been coming for follow-up, what is their bacteriology, and so on and so forth. If some patient has not come in for a follow-up, I can quickly find that out instead of looking at 3 different systems and figuring out what is happening.
The Indus Hospital has taken the lead in establishing world-class laboratory facilities for the diagnosis and treatment of tuberculosis. Funds have been forthcoming and the generosity of donors overwhelming, but so much remains to be done.
As of today, it is a 150-bedded hospital, but the plans are it will be expanded to a 700-bedded hospital with 300-bedded pediatric hospital. There isn't any dedicated pediatric hospital in the whole of the country. We do have some pediatric hospitals, but they don't have all the specialities. But this would be a dedicated pediatric hospital with pediatric cardiac surgery, pediatric neurology, pediatric nephrology, all the specialities with this. But running this hospital is very easy. What we need is we need only 100,000 people giving 1,000 rupees a month for 5 years, which will cover our today's requirement. It will cover the expansion, and then it will carry on the working of this hospital.
There is a mission at work here, and the first step has been accomplished. The Indus Hospital now invites you to come forward, to dream the magnificent dream and to watch it unfold.